Now let me take a moment to go, and I want to focus on, oh, I kind of already said this, I want to focus on the, what we're calling sort of the near-term 6-month benefit changes that are for plan years starting after September 23rd. This is where a lot of, so what do I need to do now to be compliant with the law, to respond to it, and that sort of thing. So let me focus on that. There's essentially 7 key benefit provisions that plan sponsors need to comply with starting for plan years after September 23rd. We'll talk about plan year and timing and all of that in a minute. So I'm going to just run through the list, and then I'm going to dig into each one of these. So first of all, there's lifetime limits. You can't have lifetime limits. Annual limits, annual dollar limits on essential benefits have to be removed. Children cannot have pre-existing condition exclusions or pre-existing condition waiting periods starting at that same time period. The one that's been getting all the press, you have to cover kids up to adult dependents up to age 26 on their parents' policy. It's a requirement. That one has lots of questions. We'll dig into that one. Benefit plans, depending on your grandfathering status, which we'll also talk about, are required to have a full suite of preventative benefit services without cost sharing. We'll get into that one. You're not allowed to rescind coverage. Rescission is the retroactive elimination of a health policy. You know, the stories that, well, we'll get into that. I'll tell the story at that point. But you can't rescind coverage. You can't take back and say, oh, no, we didn't mean it. We didn't offer you coverage. And then there's changes to how emergency care works. There's a couple other administrative changes that Blue Cross is already in compliance with that we can talk about too. But these are the 7 that there's actually going to be change around. So number 1, the format of the slides is a little bit what we know versus what we don't know. Some of them still have lots of what we don't know. But what we know here is you can't have lifetime maximums, period. It's crystal clear. Anything that says lifetime maximum on anything that you would deem sort of a core benefit, you just got to get rid of all of them. You do have to also say, if there's anybody who hit their lifetime maximum in the past and therefore aren't getting coverage with you or us, you have to allow them to enroll back and give them opportunity to do that. What this really means for our policies, it depends on what your particular plan is, but the 2 basic places when we look at all of these certificates we have out with all of our customers in the market, there's really 2 spots. There is what I would call a blanket umbrella lifetime maximum. Many plans have $1 million, $2 million, $3 million, $5 million overarching maximum benefit payout on their plans. Those have to come off. And also there is many of the policies that have, for human organ transplant, a lifetime maximum for that. And those are going to have to come off. And we'll talk about the timing of that. This is probably the clearest one. Anything that says lifetime maximum, erase it. This is some stuff that we know and some stuff that we don't know. They actually issued regulation on the annual limits on essential benefits, right? So they said, annual dollar limits on essential benefits. And when they came up with the regulation, they said, we're not going to tell you what essential benefits are. It makes it a little bit difficult to figure out what to do with this one. The other interesting part is, when we sort of look at the market, and this is the difference between policymakers writing regulations versus people who sort of operate in the market. Most plans, when you look around, they will sometimes have those lifetime limits, but no one says, yeah, and then there's an annual limit when you add up all the benefits in a year. There tends to be annual limits on specific benefits. Like, physical therapy, we have a limit of whatever. That is more common than having this umbrella one. But when they wrote the regulation, they said a couple things were clear. You could do, as Justine said, dollar limits have to go away, but you're allowed to have visit limits, day limits, service limits, you can do that sort of thing. But when they did all the examples, they didn't say, are you talking about benefit-specific limits, like, I'm picking on physical therapy, that you can't have one for a specific benefit category? All the examples were sort of umbrella across all benefits. So this is one where we have regulation. We actually don't know what to do with the regulation. So I don't think we can act on this one. And so there is this idea that we're supposed to make a good faith effort. A lot of our plans don't have a lot of dollar-based limits, but this is one that we're not ready to take action on And we advise you, if you're the plan sponsor of a self-funded plan, I don't think there's enough information here to let us say, yes, we can go forward with this one. So that's what the story is on essential benefits at the moment. Let's see, what's next on the list? Children's pre-X. Justine covered this for the most part. If a child is under 18, you can't exclude certain conditions, or you can't make them wait to get coverage. So a child comes on policy, it's a new employee of yours, they have a child, they have a condition, you got to pay for it. This is a big deal in the individual market, but I know that some of you have policies because you don't want people hiring into your workforce just to get benefits. People will be able to do that, and that's kind of a concern, a workforce management concern that I think you'll have to say, how do we make sure we're recruiting for the workforce and not recruiting for health benefits? That's going to become a bigger issue when the entire market is guaranteed issue, no pre-X, that sort of thing. But that's the story on child pre-X. There's only, depends on the people in the room, there's only a limited number of, I think, employers that tend to put explicit pre-existing condition clauses on their group plans. And there's some regulation around that as well. But that's the one on children. All right, so this is the one that's everyone says, did they really mean that? That they really wanted to say you could have a child who doesn't live at home anymore, they're married, they have their own job, and I, as the employer, have to pay for that child's health care? Yes, that is the answer. We've tended to have a policy that says, under certain circumstances, you can have one of those dependents on, and if you're insured, you do have to pay a separate premium for that. I'm going to talk about how we're going to address that. But essentially, they said, you got to remove all those conditions. They don't have to live at home. They don't have to be financially. You don't have to be claimed as a dependent on your taxes. They don't have to be in school. All of those things that we used to put as, under these conditions, those adult dependents can be on your plan. All of those go away. There's essentially, let's see, I got to read it. Oh, it doesn't have the definition. The definition is in another spot. I thought we had it. So for Blue Cross plans, we're the plan sponsor. We've said it's biological children, stepchildren, and legal adoption is sort of the formal definition. What you all will have to do is say, make the determination of what is considered a dependent, and then that will have to apply everyone all the way up to age 25. And we're going to get to, and if you, this might be a special situation, but I'll just bring it up. There's a lot of employers that say, I want to do that, but I also want to give certain circumstances. If I'm a grandparent taking care of my child's child and I'm principally supportive, you can do that. And you're not required to do that all the way up to 25, as long as you separately identify what's considered a child dependent and separately identify what's considered someone who's principally supported, sort of thing. So this one actually costs, the ones I've done so far, we're not sure we can take action on the dollar limits on annual dollar limits on essential benefits. But most of the other ones don't cost people a lot of money. This one costs money because there's more people that you and we are going to have to cover on our policies. So there's probably a few more questions on that, but that's for real. You have to take action to do a couple of things. Make sure you have clear definitions of what and who a dependent are. That you have an open enrollment period for that, and then we'll talk a little bit about how the rate setting process is going to go into that and have an enrollment plan. Okay.